Good afternoon. Rich Fitzgerald, County Executive with Dr. Bogan, Dr. Deborah Bogan, Director of the Allegheny County Health Department, doing our weekly update. Coming a few minutes late today because obviously following the Governor and Secretary Levine and the announcement that they made regarding statewide implementation of some changes that are coming about. We certainly want to be supportive and follow what they were doing. And you will see as Dr. Bogan and her team evaluate what has come out, we're certainly going to follow the governor's guidelines, particularly around bars, restaurants, taverns, bistros, etc. But also knowing that there may be some changes that could come about. We're a little bit different as a large urban county compared to some of our rural friends. They don't have a Carson Street, a Butler Street, a Walnut Street, Oakland, etc. But a lot of the things that we do in Allegheny County are very similar. Schools, for example, a building where you have 300 or 400 people or students are going to be similar no matter where that would be. Amusement parks, things like that are fairly common. So certainly the health department and Dr. Bogan will be reviewing the guidelines that the governor just put out and be evaluating that as to how that will affect us here in Allegheny County. As you know, for the last 2+ weeks, we've had a rise in cases, consistently hitting around 10-11%, which is much higher than we used to have at 2 and 3%. Much more testing is certainly going on. We're hitting numbers that we never hit before, over 200 a number of days. Yesterday hitting a high of over 300. But again, to put that in context, there was a lot more testing that was done, and in some ways the percentages have stabilized and hopefully will start to go down, but we'll see those in the coming days. The other thing is, and put on the dashboard that Dr. Bogan and the board put out at their monthly meeting or bi-monthly meeting, talking about where these case investigations have come from. And I think it's very interesting and informative to be able to see the difference between bar, restaurant patrons, parties, retail establishments, grocery stores, salons, sports, gyms, weddings and funerals, and then of course travel. We know that travel has been a big thing, and as people go on vacations, we're certainly going to continue to urge people to stay home if they can, do staycations, but we understand that some people are going to be traveling and want them to do it as safely as we can. Again, there's a number of questions I think that have been brought forth that Dr. Bogan and myself will try to answer over the next few minutes. And with that, let me introduce Dr. Bogan to go up and give us an update on the things that are happening here in the county and with the health department. Dr. Bogan?
Good afternoon, and thank you for joining us. So as Rich said, our case counts remain high. Over the last week, we've averaged about 200 new cases reported each day. And the trends for these cases remain the same as well. Younger people are telling our case investigators that they've traveled, they visited bars and restaurants, or attended private parties or family gatherings. But today, I really want to spend most of my remarks talking about testing for COVID-19. As you know, the demand for testing is quite high in our region for a wide variety of reasons, including our increased cases, our travel recommendations from both us and the State Department of Health, from our long-term care facility mandate for testing, our return to work, and the CDC recommendation that close contacts of known cases be tested as well. So since the beginning of July, we have performed more than 20,000 tests in the county, and we have had 5 days during which we've had more than 2,000 tests performed. But despite these increases, we are hearing from people about long waits for those who seek specimen collection and a lot of variability in wait time for the results of their tests. So we at the County Health Department are continuing to expand specimen collection and testing. We ordered more tests from Curative for our federally qualified health centers. We are coordinating the mobile testing sites that exist in our community, including the mobile test van from Allegheny Health Network, Squirrel Hill. Metro Family Health is doing some targeted testing in the community, and there are others as well. And we're working to develop more testing or specimen collection capacity in the health department itself through some rapid response mobile testing units, and working with other organizations to increase what we have available. And as those become online, we will certainly update you and update our website. So with the increase in specimen collection, some labs have faced challenges in turnaround time and getting those results out to people, especially the national laboratories. So we continue to look at that and try to send more testing to local labs that can handle it. So given our current demand for high specimen collection and testing, we really need to prioritize those who need to get these services the most. So I ask for the cooperation of the public in implementing the prioritization which I'm going to describe. The following scenarios describe those who should seek testing in order of priority. So if you have symptoms of COVID-19, we want you to get tested. This is really the most important group. It is critically important that we have enough tests for anyone experiencing symptoms to get tested. So if you have symptoms, even mild ones, please stay home except to go get tested or to seek medical care, and stay home while you wait for those results. And even if your test comes back negative, we know that there are false negative tests out there, so please continue to isolate for at least 10 days until after you have first started to experience symptoms, and 3 days past your symptoms resolved if you feel like your symptoms are consistent with COVID-19. If you are a close contact of a positive case, so someone, if the health department calls you and indicates that you are a close contact of a known positive case, you will be instructed to get tested and to quarantine for 14 days. A close contact, again, is defined as someone who was within 6 feet for at least 15 minutes with or without a mask. Close contacts are determined during the case investigation, and then that list of contacts is passed on to our contact tracing team, who call and advise about quarantine and about testing. I want to emphasize that even if your test is negative and you are a close contact of a known positive case, you must remain quarantined for 14 days since there are false negative tests. Our third priority group is our healthcare workers and our first responders who have had a known exposure to COVID-19 or at high-risk travel. These people work on the front lines of the pandemic to keep us safe. We put out detailed guidelines on the difference between high and low-risk travel. The information is available on our county website. And then the lowest priority for testing is really adults without symptoms who cannot quarantine for 14 days, who suspect that they had an exposure, but are not a close contact, but they may have, for instance, had high-risk travel. So I understand that not everyone can quarantine for 14 days or work from home, but if you absolutely must return to the office or leave the house, then seek testing. But know that a negative test, again, doesn't guarantee that you don't have COVID-19. So these scenarios, in the order I gave them, are our county's priorities for testing. I'm asking people who do not fit into these categories to not get tested so the groups that I mentioned above can. And I know this is a departure from the guidance I gave a few weeks ago, but the spread of the virus has changed dramatically during that time, and we have to be flexible and responsive to what we can do. So here's a couple scenarios where we ask that you not get tested. So adults without symptoms who can quarantine for 14 days. If you aren't showing symptoms, but you're worried that you may have been exposed to COVID-19 or have high-risk travel, stay at home for 14 days. Remember, one of the first pieces of guidance from Governor Wolf's reopening plan was that if you can remotely work from home, please do so, and we should continue to do that. And if you can stay home for 14 days, do that instead of getting tested, unless, of course, you develop symptoms. Children without symptoms and who are not close contact of a case can almost always stay home for 14 days and should do so instead of getting tested if they aren't showing any symptoms. It may mean missing a game or a practice, but seeking testing to return to sports, unfortunately, isn't a priority at this time. If a child is showing symptoms of COVID-19, it's important to contact your pediatric healthcare provider and arrange for testing. And people who are concerned, I know there are a lot of people out there who are concerned that they might have been exposed. If you were recently in a crowd, shopped in a busy store, or were in a situation where it's difficult to keep 6 foot apart from each other, I understand that you may be concerned, but seeking testing may be challenging at this time, and we ask that you monitor your health, and if you begin experiencing symptoms, then seek testing. So again, quarantine for 14 days after travel is a great way to reduce the spread of the virus. And one other issue that's come up is people going to the emergency department for COVID testing who do not have symptoms. The emergency departments are not prepared to test people who do not have symptoms for COVID-19. Please use the ED for COVID testing only if you're sick and need medical care. Please use the other specimen collection sites for the other circumstances. So the other aspect of testing I want to talk to you about today were the results of the tests that came in yesterday. On Tuesday, we reported 331 new cases of COVID-19. Tests for the cases reported Tuesday stretched back to as far as June 8th. And those tests that came back were from Curative, and that's the lab that the County Health Department has partnered with to provide testing at our federally qualified health centers in the county. So between June 8th and June 30th, there were 73 positive cases that weren't in our NEDS database until Tuesday. And between July 1st and July 8th, there were 113 cases that weren't in the NEDS database until Tuesday. And these cases should have received notification of their positive test result before Tuesday through the Curative process that either texts or emails people their results, and from the providers who collected the tests. But this means that our county health department, case investigators, and contact tracers were not aware of these cases until Tuesday, and efforts to investigate and trace those contacts and advise on quarantine were hampered. Upon learning of these late test results on Tuesday, my team launched into an exhaustive investigation to figure out what happened. We talked to Curative, we talked to the State Department of Health and the laboratory there. We found out that starting with test results on June 8th, something went wrong with the way Curative was uploading the electronic reporting of the laboratory to the state system. The state did try to contact Curative about the missing data, but did not get a response, and unfortunately, we were not notified of that problem. Curative has apologized yesterday for the failure, and in calls with the FQHCs yesterday, both Curative and I personally apologized to them, and today I'm apologizing to you. Timely reporting of any infectious disease, and especially COVID-19, is incredibly critical to our public health. Without it, we cannot stay on top of and manage this pandemic. Curative, the State Department of Health, and the County Health Department has put in measures to make sure this does not happen again. Curative uploaded data to the state system yesterday and today without any problem. And the state will notify the County Health Department if it is missing data from Curative on a daily basis. And Curative and Allegheny Health Department will continue to talk weekly about our data uploads, and we will get reports daily from Curative as well about the uploads of the data. I really take this incredibly seriously and pledge to you that we are doing everything we can to prevent this in the future. These have been very tough days here in the health department. The daily counts give us little excitement, but we really all have to stay vigilant. The steps we took in March and April were effective to flatten the curve, and those same efforts can be effective now, and that's what we need to do. And it's even more important now that we have so many cases in our midst. So please, stay home if you can. Don't go out unnecessarily. Stay home if you're sick and get tested. Wash your hands before you go out, as soon as you come back, before you eat, etc. Limit trips out of the house, as I said. Wear your mask or face shield and avoid crowds and close contact. Keep 6 feet away from people. Clean, frequently touch surfaces in businesses and the community. And please, if somebody calls you from the health department to do case investigation or contact tracing, please answer the phone and answer all of our questions so that we can work as a community to really stop the spread of the virus in our community. We really need the cooperation of the public. So again, be well and be kind to one another. And thank you. I'm happy to answer any questions.
We have quite a few for you today. The first question is from WPXI. On Monday, we were told by organizers that some protesters and leaders have tested positive for COVID-19, and several of them are not at the demonstration. Is there any indication that more than the initial 4 that the county said were positive could have COVID-19?
So the protests that we have looked at the data from June 14th to July 4th, and during that time period, 9 new cases have mentioned being present at protests or rallies. But again, that doesn't mean necessarily that's where they got it, but 9 individuals reported to us that they had been at a protest during, again, that near 1 month period.
This next question is from WESA. What is the median turnaround time of a positive COVID-19 test result right now in the county? And is it possible that this is a statistic that could be provided on a daily basis?
We do have data on that, and it's basically about 3 days, and it hasn't changed significantly over the course of the pandemic. So for the entire outbreak, it's been on average median 3 days. Before July, about 2 days, and post-July, 3 days. So not changing significantly over that time.
This next question is from KKA. What types of enforcement actions, if any, are being taken against restaurants and other facilities that might be violating the health department's orders? Is there some place that the public can go to see that type of activity?
So restaurants are called frequently, but we also send letters reminding them of the public health orders and guidance from the county. If we get multiple complaints, then we will send a food safety inspector out to the establishment to inspect and see if they're following the orders. And any consumer alerts or closures are posted on our food safety website for the county.
There are several questions related to the delay in test results that have been seen over the past few weeks as the labs are slowing down. The question is from Tribune Review, how can the county make decisions based on old data? And how useful is the data if it isn't being reported in real time?
I assume that is about delayed positive test results. So again, one of the reasons I spent so much time on my remarks today about staying home for those times, so we ask people to remain at home while they're waiting for their test results. Again, that is the only thing we can do right now if there are delay in tests. We're also working to try to identify laboratories that can handle more tests so that we can shorten the turnaround time. But again, if you're a close contact, regardless of your test result, you need to stay home for 14 days. So again, in communities where when you're really effective and you close things down, the reason you stop spread is because people aren't going out and getting near one another. And so the way you stop spread is to keep people home. And the guidance doesn't change, again, even with a negative test. We don't want people heading out to the restaurants until their 14-day quarantine is over.
This next question is from the Post-Gazette. There has been a lot of talk about how these high case counts are not a cause to worry because they are in younger people who are more likely to recover, thus giving us herd immunity. Is there any scientific basis for those claims? Is herd immunity something that's actually achievable?
So again, as the county health director, I'm concerned about every case in our community. If you look at the data on our website about hospitalizations, even among young people 20 to 29 or 30 to 39, those people still get hospitalized at a rate of about 1 to 1.5% of positive cases. So if you get enough cases among the healthy young adults, you still get serious illness in those people. And those are, being hospitalized is a serious event as far as I'm concerned. So I think we should all be worried when there are a lot of cases in the community. And again, people live in multi-generational homes. They work in multi-generational businesses. And again, even though those young people maybe recover and do fine, they unknowingly may be spreading it to people who are going to have much worse outcomes. So again, we are in this together, regardless of your age. We are a community that ages and rages from birth to over 100 years of age, and we need to treat ourselves like we're a large community with people at risk.
This next question is for the county executive, also from the Post-Gazette. County executive, you've said you don't want to go back to yellow or red, but if the case numbers continue to be 100 to 200 or more a day, does that become a real possibility?
I don't know that we would go back, to yellow or red, but I think what Dr. Bogan and her team will do is continue to monitor through contact tracing and case investigation where those hotspots would be. As was indicated by some of the ones she's indicated already around bars and travel and things that have had some of the higher numbers, they're going to be looked at. So if there's other operations, whether it's offices, whether it's manufacturing, whether it's construction, retail, et cetera, those things will probably be looked at. I think the approach that Dr. Bogan and her team have taken is to be strategic, rather than just doing a yellow or a red where everything gets shut down for a certain degree. Looking at it strategically, which allows people to have their normal workday in some regard, but also be protective of those case counts from getting too high.
This next question is also for the county executive from WPXI. The state has given approval for Kennywood and Sandcastle to reopen. Are you concerned about these large gatherings when the county has limited other outdoor gatherings to 50 people?
It's always a concern just about in any operation, but one of the things that the state has done, because there's probably a dozen or more amusement parks around the state, whether it be Hershey Park, in the middle of the state, or Sandcastle here, Idlewild Park in Westmoreland County, et cetera. Amusement parks are going to have a lot of folks. I think the plans that they've put forth to the state have been approved because of some of the mitigating factors and some of the mitigating strategies around people wearing masks, you're outside, physical distance, limiting crowd size, all those type of things. But I'm sure it's something that's going to be monitored both locally here in Allegheny County from our parks, Kennywood and Sandcastle, as well as throughout the state. So it is a concern, but it's something that will be monitored in the coming weeks, and I'm sure case investigation and contact tracing will be looking at that closely.
These next questions are again for Dr. Bogan. This question is from WESA, and excuse me, there's actually multiple outlets asking the same thing, and which is could you please tell us how the governor's order today will impact the county's orders as it relates to a number of the mitigation measures that are in fact here?
Well, let me just say that I learned about the governor's orders only just recently, and so I haven't had a chance to review them in detail. But our orders, we certainly will review them very carefully, see how they relate to the ones we currently have out. Again, we can never be less strict than the state order, but we can be more stringent if necessary. Again, we are not like the rest of the surrounding counties in that our cases are much higher. We have a more dense urban area, and so we, again, need to decide after I review them and to review it with our team, what would be the best approach. So I don't really have an answer because, again, I just am learning about the details of the governor's order at this time.
Related question from WTAE. There was a comment at today's Pennsylvania Department of Health news conference that the virus is washing over the Pennsylvania state line from Cleveland and Columbus, where community spread is occurring. Should we not drive to Ohio? What about West Virginia and some of the neighboring areas that residents from Pittsburgh and this region tend to travel to?
Yeah, my advice to everyone is stay home if you can. That's really the best thing we can do right now. There's community spread here in Pittsburgh. There's community spread around the country. And I don't have any better advice. I just wish people would stay home as much as they can.
This next question is from WPXI. Do you find that people are upfront with contact tracers about their whereabouts? And I believe that actually should have been case investigators.
Yes. So, again, we find that that people really are upfront and share information with us. And that's really, really important because it allows us to make good decisions for our community. So thank you for all of those people who have answered our calls. We have found in the last couple of days some people who are reluctant to give us their contacts. And what they've told us is we've reached out to our contacts already and they already know about it and they're going to get tested. But the problem, and so we ask people to please share their contacts with us. We do more than just provide guidance. I did contact tracing myself on a Sunday, and I answered lots of questions that people had, and I corrected misinformation that they had. So contact tracing not only gives them advice about quarantine, it also answers the questions they have, like, why, if my test is negative, do I have to stay home for 14 days? So we explain about how the virus can present over that time. We go over the symptoms that you should worry about, how to get tested, resources. We ask people if they need resources and things like that. So again, people have been very good about answering our case investigators, but a few have been reluctant about giving their contacts. But we encourage you, this is confidential, we don't share the information, we keep your information private, and we're really doing this to keep you and your contacts safe.
This next question is from KDKA. The health department has spoken recently about it's taking longer to get to people that are being contacted for both case investigations and contact tracing. Is it a shortage of contact tracers that's causing that? And if not, what does cause the delay?
Our case investigators is where we're actually having more of an issue. Again, we had planned for a surge in late August or the beginning of September of this capacity, but we hadn't. So we were in the process of hiring people very strategically in July and August and training them as case investigators. And we obviously did not predict appropriately. So we have been hiring case investigators, and we've been using other people. I sort of went through in my remarks at the Board of Health about all the people who've been helping us with case investigation. And that's where we've been behind. But again, one of the reasons I emphasized today is if you have a known case, you are a positive case and we haven't called you yet, please stay home, remain isolated. We will be calling you. In terms of contact tracing, we have been able to keep up. We have trained a large group of volunteers. We have hired a number of people. We have other people in the health department helping us, and we continue to expand our pool of contact tracers, so we've been able to keep up with the contacts.
There are two related questions from the Tribune Review specific to the delay in test results. How is that impacting case investigations? And specifically how it impacts restrictions. If those cases that have been delayed had been reported sooner, would that have changed the restrictions that were put in place? We are going back to call the people who we missed, and hopefully they were, again, people should have gotten their test results electronically through either a text or their email, whatever their preference was, and there are instructions in those results that tell you to stay home, and it gives instructions on isolation. So I hope that those people followed those guidances, and they also, most or all of them, should have received a call from the group that tested them. So we hope that they were all contacted, but we're going to follow up and find out, and hopefully learn a little bit more about that impact. And there's a follow-up question from Public Source. Is the health department prioritizing those case investigations to have people reach out to the newer ones versus the older ones that may have already been recovered?
Actually, we had multiple discussions about that, and at this point we're prioritizing the current cases and trying to reach out to their contacts as well, but we are working very hard to get to all of the cases as quickly as we can.
This next question is for the county executive. From WPXI, we've spoken with a number of attorneys who have expressed concerns about the lack of COVID-19 precautions at the county courthouse, and at least 2 assistant district attorneys who've been infected and are in the hospital. The county executive's office is in the courthouse. Are you concerned about all of this?
Yes, we're always concerned to hear cases that come in from wherever the source might be. At the courthouse, there's a lot of precautions. There's signage all over the courthouse. There are markings on the floor where people are to stand, to get in the elevator. There's even markings in the elevator of where people should stand. The one thing people need to understand is there are 7 independent offices within the courthouse, not just the county executive's office, county counsel, 4 row officers, and the courts themselves. People have to wear a mask when they come into the courthouse, when they come through the guard station. But then once they get in there, those independent offices, have their own rules. I know they're following CDC guidelines, and they might even have more strict interpretation of things that they do within their courtrooms, within their offices. So it is something that we're very, very supportive of. We're continuing to monitor. The other thing about the operation of the courthouse and the county operation is it's an essential service. We just can't shut it down, and many of these things can't be at work. I will tell you, I've been to the courthouse every day since March 15th. I know my chief of staff, Jennifer Liptak, and Willie McCain, county manager, also have been there, oftentimes on weekends. I know Amy Downs has been there every day, and many folks that are trying to do the things to run the operations that the county needs, whether it be the health department, whether it be the jail, the Canes, public works, parks, all the things that we need to do to keep essential public services moving, to keep the PPEs, the 911s, and all the different things that happen are run from the county.
The rest of the questions are for Dr. Bogan. This next question is from public source. Research indicates that COVID-19 tests may miss as many as 1 in 5 cases, and some of this is likely due to incubation periods and the point at which the test is conducted. Are you finding that there are other reasons for false negatives, and if so, how does that impede protecting the public health?
So for sure, there are data that there are false negatives. And again, false negatives can happen anywhere along the process of when the sample was collected, how the sample was collected, how it was processed in the laboratory. Again, for tests that require cold chain, meaning they have to remain cold, again, if they get warm, that could impact it. I am not able to find out from the data that I have what the false negative rate is. And again, I'm worried that people are going too soon to get tested, maybe not getting tested at the right time. And I think I made it really clear in my comments today that we do have false negative tests, and that if you have symptoms or you're a close contact and you've been placed in quarantine, you really should follow those guidances to reduce the spread in our community because of those false negative tests. I pray every day for a test that is more sensitive and specific, that would help us all across our country, but I don't have the powers to make that appear at this time. But the sooner we get that, the better off we all are in responding to this pandemic.
You also touched on this, but I've received 2 questions, one from the Post-Gazette and one from KDK Radio, asking whether you see any evidence in the data that the targeted restrictions on restaurants and bars is working, and if not, will there be more restrictions in place? And then on the flip side of that, whether we would change our guidelines to meet those of the state and allow 25 inside.
So to respond, have we seen an impact? So we were having doubling of our cases every day, and we have not seen a doubling now. We've sort of been stable for the last week or so. I hope in another week we'll see a decline. Usually it takes a couple, 2 to 4 weeks to see any effect of your mitigation strategies. That's what we saw with our first round of cases. That's what's borne out from other cities and other interventions. So I don't expect to see a big change yet, but I hope in another week or 2 to see that we're having an effect. Again, I am not prepared at this time to decide what we're going to do with the change in guidance from the state and how that impacts us at this point. Because again, they came out right before they ended their press conference and we started ours, so I haven't had time to review it or discuss it with my team.
I have 2 final questions, both a specific one, both and a general one, excuse me. What is the health department's role and plans for school districts and universities as they return? That's the general one. I'll start there.
The question is about schools?
Mm-hmm. School districts and universities.
Yeah, school reopening is a huge challenge. And again, if we had unlimited amounts of testing, if we had a really sensitive and specific test, we might be in a different place than we are. But there's a lot of uncertainty because we don't have either of those. And when I have been on calls with the school districts, I think we basically need to plan for 3 potential scenarios: that we reopen using the guidance that we have out there now, we open with significant modifications, But then we don't know what's going to happen in November and December. So I think you need also contingency plans for significant modifications to that, and then of course the potential for full closure again if we experience something like happened in some communities in our country and across the world. So I think we just need to be incredibly flexible and have multiple plans ready to go depending on what we see. And again, if we get a different kind of test available, our vaccine becomes available, all those things change how we respond. And we just need to be open and constantly looking for the best data that's out there. For instance, there aren't even great studies that look at the spread between children and children to adults. And if we had great data on that, that would inform our decision making. So we keep continuing to look in the literature for data that supports evidence-based decision making.
This final question is from the Post-Gazette. It's very specific. The University of Pittsburgh is only publicly reporting the number of students who test positive for COVID-19 who enter or live in university buildings, and not counting, for example, students who are attending and taking online classes but live off campus. What do you think of this reporting? Is it an accurate representation of the risks returning students might face this fall?
Well, don't forget, if there are cases in the county, the health department is calling them, so we know about cases whether they're living in the dormitory or not, and so they should be getting good advice on that. I'm not that familiar with the information that you just provided in terms of Pitt specific, but again, we have an approach across the whole county to reach out to people regardless of where they're living, so hopefully our case investigations are reaching all of them regardless of Pitt dormitory or not.
That was the final question. If there are any closing remarks.
Thank you, Dr. Bogan, and thank you for a very detailed information about what's gone on over the last week and where we're going to go in the coming weeks. It's, again, following the governor's press conference that just ended right before we began, to be able to review all of that information. The biggest thing is I want to thank the community for the cooperation that we've seen. So many people now are wearing their masks, as we know how important that is. We know that it's such a critical part of stopping the spread. And wearing your mask tells me you care about your community, you care about your neighbors, you care about your family, because you are protecting them when you're wearing the mask. It's not really about protecting yourself, although there is some of that. You're actually protecting those around you, your coworkers, people that you would encounter in an operation, retail, restaurant, whatever it might be. We want to continue to do that. We know we have challenges, and Dr. Bogan and her team are staying on this and making sure that when we see some areas of hot spots or spike, that action is taken. And that's something we're all going to be living with in this new normal. We're going to have to continue to make changes. We've got to be flexible. There's no rules that can be said that are going to be made today or tomorrow that might be in place a month from now. You follow the numbers, you follow the cases, the virus is in charge, and we're dealing with that, and we have to try and contain it as best we can. Until there's a cure or until there's a vaccine, we're going to continue to live this way with helping ourselves, helping our neighbors, and helping our community. So thank you to everybody that continues to help, our friends at the health department, our first responders, the people that are going out and serving us and continuing to do the good things that are happening. Let's stay safe, wear your mask, stay physically distant, stay home when you can, and continue to